I'm Bron Tuller, and this is Psych Matter. This will be part 3 of our discussion related to suicide and will be the final piece of this special topic. By the end of this session, my hope is that we'll all have a better understanding of how to take care of somebody who is in need and how to keep them safe when their suicidal ideation or depression gets to a point where it is no longer safe. So if you recall from parts 1 and 2, the first thing that you need to do with a suicidal individual is identify whether they are actually suicidal. And we do that by having a good close relationship so that we're able to talk and ask open questions to get honest answers. After somebody has been identified as experiencing either severe depression or specifically suicidal ideation, then it goes into the assessment phase, which is primarily made of, is it passive suicidal ideation? So they have thoughts of, but not actively moving towards, or is it active suicidal ideation, which means that they are actively pursuing the taking of their own life. If you remember in the first part, I talked about some statistics, and those statistics are also going to roll directly over into the assessment. So, brief review: white Caucasians more likely to successfully complete suicide. Male are more likely to die by suicide. Men. If somebody has access to a firearm, that's going to be the most dangerous method that they could use to attempt. So, and then age is the last one, and the hot age group is between ages 45 to 64. Outside of that, there still is risk, but that's the highest risk group for completion of suicide. So you need to take all of those things into consideration when you do the assessment phase, because it's all going to weigh into your decision making with, now what do I do? I've identified somebody who's suicidal, I've assessed their danger level, and now where do I go from here? So let's talk about the management. So, management of somebody who is suffering from suicidal ideation is really delicate and really tricky and not fun most of the time. And we're going to go into detail about this, but what it really comes down to is keeping the individual safe. And the first thing you have to decide is, with all the data you've gathered from the assessment, the grand summary question is the person dangerous? So what does danger mean? Danger, by definition, is exposure or liability to injury, pain, harm, or loss. So if somebody is a danger to themselves or others, there's a potential for injury, pain, harm, or loss. If somebody is a danger, then you need to do something in the moment, right then and there. This is not a time to say, well, let's keep an eye on things and see how things go. If you, using all of the information we've talked about, assess somebody as being a danger, then action needs to be taken there in the moment. People who immediately qualify as being being in danger, are people who are actively suicidal. They qualify for that danger zone. People who are, of course, out to harm somebody else in some form or fashion. And then people who are out of control. The out of control one can be a little bit tricky. But people who are under the influence of substances, whether it's alcohol or any other substance, if they're not in control of themselves, they are a potential threat. They could potentially cause injury, pain, harm, or loss. And so they would qualify as being a danger to potentially themselves or somebody else. That also goes for somebody who is out of control emotionally. Whether that's somebody who's suffering from profound grief, whether that's somebody who is in the manic phase of a bipolar mood swing, whether that's somebody who is having an active episode of psychosis, like somebody who's schizophrenic. All of those types of things could potentially put somebody out of control of their actions in an altered state of mind, and therefore they would fall under that danger category. The passive suicidal ideation may or may not be dangerous, and that's the tricky one, and that's where my strong recommendation is to rely on psychiatric professionals or medical professionals to do the evaluation. You always want to err on the side of caution, but it may or may not be something that needs to be acted on. So the big question is, once you identify somebody as being dangerous, what do you do? And the answer is anything and everything to keep the individual safe and sound. Obviously, so every even county, every state, every county of the state is going to have different resources available. So I would strongly encourage that you do a little bit of research, just Google what's available in your area, because it's all going to be completely different. But there usually are some general places that you can seek assistance from. Number one is the most obvious, and that is law enforcement, basically calling 911. People are really scared and hesitant to call 911 on a friend or loved one. They don't want them to get in trouble. They don't want to ruin their relationship with the person. And what I would say to that is, which is more important, the individual's life or having them be mad at you, or having a bill of some kind, or, it always has to be safety first. So do not hesitate to do whatever needs to be done to keep the person safe. But law enforcement is always a good option. I would call it, again, if the assessment is that somebody is immediately dangerous, either to themselves or to somebody else, 911 is the best thing. You always want to keep eyes on the individual. So this is not like, I'm going to go into the other room to make a call. You need to stay with the person, so that you're a source of comfort and care. They know that they're not alone, but then also because you need to make sure that they don't do anything to harm themselves. So 911 law enforcement. Another option is to take them directly to the nearest ER, emergency department, or psychiatric hospital. A lot of psychiatric hospitals have basically point of care, same day assessments to see if somebody needs to be held overnight, needs to be psychiatrically hospitalized, but that's also an option. The big thing with this one is the individual cannot take themselves. And I know that might sound a little bit silly, but if somebody is suicidal, again, they've been assessed as being potentially dangerous. They should not be driving for multiple reasons. One is that they may not be in a good state of mind to drive. Two is that if somebody's really intent on taking their life, being behind the wheel in a car is probably not a good place for them. So you want to take the individual there directly, or ensure that they have somebody who's taking them there. So this can't be like, well, okay, fine, the individual says, fine, you're right, I'll go, I'll drive myself to the hospital. No, you need to go with them to ensure that they get there safe and sound. So that's sort of the second super common way of managing somebody who is in imminent danger, is to take them directly to the ER or hospital. Now, when you go to the ER, because that's probably the most common one, when you go to the ER, they're going to probably make you wait. So they'll probably make you wait, and then what they'll do is they'll do a psychiatric assessment, and they usually have a social worker or some other mental health practitioner who will come down and talk with the individual to see if they need to be hospitalized and detained, or whether they need to be given something to help them calm down, or lined up with outpatient services. It can be a long process, but again, none of that can weigh into the equation, nor can money, because that's another one I hear all the time is, well, I can't take them to the hospital because they don't have any money, or I don't have any money. Again, you have to be realistic with this and say, okay, so how much is a life worth potentially? And I can promise you that it is not what a hospital bill would be. So those are probably the two biggest, and I don't want to use the word dramatic, but for lack of a better term, like those are like the big obvious ones, is call 911 or take them directly to a hospital. If the person is definitely having some dangerous thoughts about suicide, but they're not like it's going to happen right this second, some other sources of help can be primary care. If you contact the individual's primary care provider and say, hey, this individual, I'm really worried about them, they're suicidal, what can we do? 9 out of 10 times the primary care is going to say take him to the ER, but if you have a nice close relationship and they have an opening, they may say bring him in. So that can be another source of assistance. Another one is that most areas have a suicide hotline, and in fact, every place has a suicide hotline. And so that can be another source of assistance. You can call or have the individual call the suicide hotline, and they will walk you through some, again, risk assessment type stuff, and to see what needs to happen. But that can be another really big source of information and help. A lot of places will also have sort of centralized isn't the right word, basically local assistance. So I live in Utah. Utah schools, for example, have the Hope Squad, which is an excellent program where peers are available to talk and to help people who are suffering from mental health conditions, specifically depression and suicidal thoughts. But things like that. So there's lots of different sources that you can turn to for help. The big thing to remember is that if somebody is a danger, if they're actively suicidal, if they are out of control, or if they're dangerous to somebody else, that you have to do something about it right then and there. So do whatever needs to be done in order to keep people safe. A couple thoughts about psychiatric hospitalizations, and this I know makes things a little bit complicated, but I think it's important to understand. Fun fact, psychiatric hospitals are not happy places. Nobody wakes up in the morning and they go, you know what, I'm going to go on vacation to the local psychiatric hospital. So you need to understand when somebody goes in for evaluation at an ER, and if they are admitted to a hospital, they should only go to the hospital if they are an imminent threat. So hospitals, regardless of what people might say, are not places of, they're not places of healing. Hospitals are places of treatment. You go to a hospital to get treated, but then you heal and you recover outside of the hospital. And a psychiatric hospitalization is the same. You cannot expect for somebody to go into the hospital and come out a week later completely free of depression and suicidal thoughts and everything else. And if that's sort of the misconception, that can lead to its own problems. The hospital should be reserved for somebody who needs to be kept safe in that immediate time frame. Because after that, after the hospitalization, they're going to step right back into the world that they came from. And I'm not saying that to be negative or to say like, oh, you shouldn't go to the hospital. But it's important that that psychiatric hospitals are utilized appropriately. So there are two main purposes that psychiatric hospitals fulfill. One is it's a place of temporary safety. It is a place where somebody can have eyes on, they can be watched, monitored, taken care of, to make sure that they have nothing happen to them that might result in injury or harm. The second is that they get immediate access to care. It's an unfortunate truth that the waiting time for a psychiatric professional is usually on the order of 2 to 3 months. And I could work from dawn till dusk and my wait time would still be 2 to 3 months because there's just not enough people working in psychiatry. Hospitalization, part of that is, of course, treatment. So the individuals usually started on medications, they have psychotherapy to help de-escalate where they're at. But the other piece to it is that they are lined up with outpatient management. So within a matter of usually just a couple weeks, they'll get plugged in with an outpatient psych provider. So those are the two big reasons why I will send somebody to the hospital. Of course, if they're in need of immediate safekeeping, or if they are in immediate need of care. So keep that in mind with the hospital. The decision on whether to hospitalize somebody or not needs to be what is best for the person. And again, this introduces another layer of complexity. And admittedly, this is a little bit more for the professional, the medical professional or psychiatric professional to take into consideration. But you have to keep in mind what the psychiatric hospitalization is going to do for somebody. I have patients that I talk with and I say, maybe we should start to think about hospitalization. And they say, if I go into the hospital, I'm going to lose my job, I'm going to lose my kids, and I'm going to be even further in debt than I already am. And they're not bluffing. I mean, those are things that actually may happen. And so you have to take into consideration what the consequences of a hospitalization are going to be. But again, that's more for the professionals. And I don't say that condescendingly by any means. For people who are non-medical health providers, my strong recommendation is to rely on professional help. Don't worry about all of that stuff and remind yourself that even though those things might be true, if the person commits suicide, it's guaranteed that they will lose their children, they will lose their job, that all of those things will actually happen. So you need to do whatever is going to be safe for the person. So allow medical health professionals to make that judgment call and decision. But again, life always has to win. So when should you hospitalize somebody, or when should you seek hospitalization? There are a couple no-brainers. One is if the person is an immediate threat to themselves or to somebody else. So if they're saying, I'm going to commit suicide, I have a plan and I'm going to do it now. That should be a no-brainer that I need to get this person to the hospital as soon as possible. If there's an inability for the person to take care of themselves. So there's a subtype, and I don't know that I would necessarily call this suicidal ideation, but it's important to mention. But there's a subtype of depression that is so profound that it generates a complete inability for the person to really function. And those types of people should also go to the hospital. In their own way, they are suicidal. They don't want to exist anymore, and they are no longer doing anything to continue their existence. People stop eating, they stop bathing, and they just sort of allow themselves to waste away. So if somebody is in that state of depression, you should seek hospitalization. Typically, if there's a timeline or closing actions, so if somebody is saying they may not be an imminent threat to themselves, but they're saying this weekend is it. This weekend is going to be the end, or my mom's anniversary, or whatever it might be. If they have a timeline, or if they are going through closing actions, so saying goodbyes, giving things away, things like that, that's another one that should be like, I need to get this person probably hospitalized at this point. And then, of course, if somebody is just completely out of control, which I've mentioned multiple times, whether that's substance related or related to other psychiatric conditions. More difficult situations is if somebody has a plan, but they aren't really doing anything with the plan. They may or may not require hospitalization. Again, rely on professionals to make that judgment call. If somebody is engaging in self-harm, as we discussed at the beginning of part 3 of this discussion. And then you also have to take into consideration, again, the life situation. Is the hospitalization, going to result in improvement overall with the individual, or is it a temporary solution? If in doubt, though, always err on the side of caution. Always seek help. Do whatever you need to do to keep the person safe. So, in summary, and when I say summary, not just part 3, but all of this discussion on suicide. Once you identify if somebody is suffering from suicidal thinking or depression, then you assess. And you do the assessment via, is there passive suicidal ideation or active suicidal ideation? And is there self-harm? Are there actions that are indicating that the individual is at an increased threat to themselves, such as the statistics that we covered in part 1? Then you go into the management phase. If somebody is not an imminent threat to themselves, you still need to seek help. So if somebody is saying, yeah, I'm thinking about dying, I'm thinking about killing myself, but I would never do it, they probably don't need to go to the hospital, but that still is an indicator that they're experiencing severe depression, and so you need to pursue treatment as soon as possible. Primary care is going to be the easiest and fastest source for these types of situations. Next in line is going to be a therapist. So there's lots of different, so a therapist is anybody who provides therapy. But this is going to include people like psychologists, clinical social workers. It may even be like ecclesiastical leaders. I mean, there's a wide variety, but usually it's faster to get into a therapist than the slowest option, which is an actual psychiatric provider, whether that's a psychiatrist, a PA psychiatrist, or like an NP, a nurse practitioner specializing in psychiatry, is usually on the order of months. You cannot say, okay, this person's passively suicidal, but they're not going to do anything to themselves right here, right now, so I'll just go ahead and get them lined up with the nearest psychiatrist 3 months out from now. Not good enough. You should get them lined up with a dedicated psych professional, in my opinion. But in the meantime, you still need to get them access to care. Because again, their symptoms are severe enough that they're thinking about not existing anymore. Keep in mind that a hospitalization is a fast track for more or less instant access to care. So keep that in mind in the decision-making process. On the other hand, if they are an imminent danger to themselves or to somebody else, you need to do whatever you need to do in that moment to get them safe. That's usually 911, law enforcement for hospital transport, or taking them directly to the hospital yourself. And I'm going to rewind a little bit because I should talk about this when when dealing with somebody who is in imminent danger. The most dangerous things on planet Earth are things that are backed into a corner. So when somebody's contemplating ending their own life, and all of a sudden they're faced with, I'm going to be detained. I'm going to be taken to the hospital, and I'm not going to be allowed to leave. I'm going to be trapped. Strange and potentially dangerous things can happen. So you need to be very cautious when dealing with these types of situations. What you want is a voluntary hospitalization. If the individual says, absolutely not, I'm not going, you should not personally yourself try and force them to go to the hospital. Nod, smile, say yes, and then call 911 because, again, this is somebody that needs to be kept safe in that moment. But never try and force somebody who is suicidal to go to the hospital if they are adamantly against it. Now, you can talk to them, you can try and convince them, of course, but never try and force somebody. I have had patients who have grabbed the steering wheel mid-transit because they refused to go to the hospital. So you need to be mindful that if the person is dangerous, it means that they're dangerous, and that can expand outside of themselves. Some things that I use when I'm talking to patients that I'm trying to get to go voluntarily to the hospital is a would you rather scenario. It sounds a little bit harsh, but a lot of times people know deep down that they need help and that they need immediate help. And so when somebody is in my office and I identify them and assess them as being dangerous, but they say, no, I'm not going to the hospital. Sometimes I'll say, well, which would you rather? We can do this voluntarily, meaning that I work directly with you to get you into the hospital, everything goes smoothly, and you're well taken care of. Or I can call the police, and you can leave my office, and I'll put out an APB. The police will find you, and they will take you into custody to keep you safe and sound. And usually when faced with that type of you can either climb in the seat with me and we can drive to the hospital, or I can call 911 and it'll be a big scene. Usually when the person realizes this is going to happen no matter what, they will go voluntarily. The other thing is to make sure that I'll do is I'll make sure that the person has a good frame of reference for where they're at. So if somebody is saying well, I'm going to lose my job, and if I go to the hospital or if this happens, I'll just remind them and say, you're thinking about killing yourself. We need to get you help now, because if you kill yourself, nothing is going to matter. So keeping things in context can also be helpful. But again, you want a voluntary hospital admission if at all possible. So that wraps up our discussion on suicide. I know that was a long hour-ish. It's probably more than that by now, but for parts 1, 2, and 3 all total. Last but not least, I want to talk a little bit more directly to people who may be experiencing significant depression or suicidal thinking. The first thing and before I start this, if you don't fall into this category, feel free to take this as a lesson of sorts in how to talk with somebody who is suffering from depression or suicide. So the first thing that I want to say, if you are experiencing these thoughts or feelings, is to say that you are not alone. There are many people out there who are struggling and suffering, and we are all in this life together. You are absolutely not alone. There are people who care about you. There are people who love you, who want you to be safe, who want you to live and be happy, and you can have that. Depression makes you feel like you have been depressed and will always be depressed. It defies logic. It wants to keep you in the dark and isolated because that's where depression feeds the best. Even though you know that the sun is going to rise in the morning the same way that it always has, depression makes you feel like the night will never end, but it always does. It always does. There are only two things that you can ever count on in life, and that is one, that things can always get worse, but also that things can always and will always get better. Life is a cycle. Daytime goes to nighttime, goes to daytime. The waves come in, the waves wash out. The way that you're feeling is not the way that you have always felt or the way that you will always feel. So don't give in to despair. Don't give in to the whispering of depression that there is no hope, there is no help. There is always help for those who seek it. So ask for help. If you don't ask for help, the odds are people aren't going to know that you actually need help. Humans by nature are self-centered. We think about our own needs. We're focused on ourselves first and foremost. And so for the majority of people, it's hard to look outside themselves and see that somebody else needs something. So speak up, speak out, let people know that you're struggling, that you're having a hard time, because there are people who are waiting and wanting to help you. But you need to talk. You need to be open with your thoughts and feelings about what's going on. And the longer you wait, the worse things are going to get. So I tend to think of it like a wound. If you have a cut that you don't clean and you don't take care of, the longer that you wait for it, the worse the infection can get. So with these types of things, with mental health issues, talk, speak up, speak out, because it can be taken care of before things get really out of hand and out of control. So keep those things in mind. Also keep in mind that, and this isn't going to sit well for some people, but it's also very true. There are few more terrible things that you can do to somebody else than to commit suicide. I have many patients that I work with directly that I see only because they are survivors of somebody who has committed suicide. There's no better way of damaging somebody. So if you're struggling with significant depression, if you're thinking about suicide, I would strongly urge you to remember what your actions can do to other people's lives around you. Also keep in mind that there's a contagion effect, that there's, when one person, especially in like friend groups, commits suicide, the risk of peers attempting or developing suicidal ideation increases dramatically. So again, you're not alone in this, and that also goes for your actions. Your actions will have an effect on the people around you. Suicide is not the way out. I can tell you firsthand with my from professional experience that it is surprisingly hard to kill yourself. There's a reason why of people who attempt suicide, only 30% are successful. That other 70%, things do not go well. And I'm not saying that as a scare tactic, but just in reality, the vast majority of people who overdose, for example, end up causing significant damage to their liver, stomach, internal organs, and some of that can be permanent, but they usually don't die. So the moral of the story is that suicide isn't the answer. Even with firearms, I've had patients that I've seen that are missing significant pieces of brain matter, but they survived. They survived the suicide attempt, but now they exist in a new, less fortunate and able way because of the suicide attempt. So again, suicide is not the way out. Treatment is. There are people who love you and care about you, and they want to be there for you. So don't consider suicide as being an option for self-treatment. Last of all, I would tell you that you can do this, that you are resilient, you are stronger than you think you are. You are capable of overcoming amazingly terrible things. You will overcome what you are facing right now. It may take time, it may take a lot of effort, but you are not without hope. So don't give up your hope. For anyone who's dealing with a loved one who's recently committed suicide, I also want to say some things to you. And again, if you don't fall into this category, take this as words of wisdom that you can pass on to somebody else. But the first thing that I want to say is my heart goes out to you. I know how terrible losing a loved one or a friend can be. So I am so sorry for your loss. The next thing that I would say is to make sure that you are not blaming yourself. When somebody commits suicide, it is a decision that they make. And whether that's a decision that they make with logic or whether that's a decision that they make illogically, it is still a decision that they make. And nobody else is responsible for that, including you. Loved ones especially tend to blame themselves. They tend to look inward and say, why didn't I see? Why didn't I know? What could I have done differently? And what I would say to you, again, survivors of somebody who have committed suicide or died by suicide, is that you're not responsible, and you should not feel guilt about what that happened. I'm not saying that you shouldn't feel bad or sad or all of those things, but if you feel guilt about it, that the guilt is not something that you need to take upon yourself. One of the hardest things about working in this field is understanding that when somebody really wants to commit suicide or decides to commit suicide, it's going to happen. If you're suicidal, or when somebody is suicidal, they have to decide to live. There is nothing that I can do or anybody else can do to instill the will to exist in someone else. They have to come to that conclusion themselves. And so again, the weight of that loss, I hope that you are not carrying on your shoulders. In that same vein, because again, like I mentioned in part one of this discussion on suicide, one of the biggest people ask is why? Why did this person decide to take their own lives? And at the end of the day, you can't help something that you don't know about. So if that person chose not to confide in you, if that person chose to keep it to themselves, you cannot take that weight on your shoulders that you somehow should have known. You somehow should have seen the warning signs. And again, that goes back to what I just said, where if you do have suicidal ideation or significant depression, you have to talk, you have to speak. And I hope that on either side, whether you're experiencing or you are not, that you have a close enough relationship with somebody else that you're able to talk about these difficult things. There may never be an answer to why somebody takes their own life. At the end of the day, we don't know. And I would even go so far as to say that it's not our place to judge. We don't know what the person was feeling or thinking or experiencing. We don't know all of the information. Even when we think we do, because one person's depression is different from another person's depression. So we may never know the answer why. And even though that can be hard to accept sometimes, understanding that putting one foot in front of the other is going to help with the process. For survivors of a suicide, it's a terrible thing to say, but it's also true that time heals all wounds. Even though you may not feel like it, every moment, every second, every minute, every hour, every day, every week, every month that goes by, even sometimes years, that pain becomes less. And you continue to live. My advice for those who are grieving is to celebrate the life and not the death, and to keep moving forward. Again, for survivors of suicide, if you are struggling with your own depression because of the suicide of a loved one, seek help the same way. This has, again, a contagion effect. When somebody commits suicide, it's like dominoes. It's ripples that can become tidal waves. So if you are struggling with the loss of a loved one, seek help, seek therapy, whether it's, community access, group, personal, for some people even medications. But don't allow yourself to slide down that same slope. Suicide, to summarize and to wrap up this discussion on suicide affects everyone, and we are all in this together. When we all have a better understanding, when we open our hearts, and we make sure that we're being mindful of each other, we can decrease this horrible epidemic that is happening. And it is an epidemic. Statistically, suicide is increasing, depression is increasing. It's something that we all need to be aware of and mindful of. But together, we can decrease the tragic loss of lives to suicide and to depression. Remember, you are never alone. You may be unaware, but you are never alone. So please seek help and remember that we are all in this together. Again, I hope that you have found this discussion on suicide helpful. I know it can be a difficult topic to talk about, it can be difficult to hear about, but it's something that is very important. Human lives are worth more than anything, and if that means talking about some uncomfortable things or hearing about some uncomfortable things, it's worth it. Never give up hope. Always know that there is help if you want it. Thank you for taking the time to listen and think about this discussion on suicide. I'll hope to see you in future sessions. Until then, please take care of yourself, and please take care of other people too.